So I'll tell you how we try to explain this. So it was actually an American ophthalmologist I'm quite close to, and he has a 14-year-old son. And the son said to him, "Dad, you have to give me one of two things. You can't say neither. Could I have a tattoo right here or an eyebrow piercing?" And without a doubt, the dad said, "An eyebrow piercing. I can remove it." A tattoo, once it's done, there will always be a scar. Even if you remove the ink of it in years to come, there's always something that's not quite the same. So in LASIK, if we think of the cornea, which is this, as a bit like a cake of many layers, like a millefeuille, what we actually do is we lift up the first layer of the millefeuille, right? And depending on your prescription, the higher your power is, the more of this cake we would have to thin. So we're permanently and artificially thinning what you have been born with, right? And this being, this is like the windscreen of a car, because this is where light goes in. So if we scrape across the cornea, then of course your quality of vision drops. It's very much like scratching the windscreen of a car. Yeah, so that causes glare. And the other thing that I haven't mentioned is that within this millefeuille are nerves that make tears. So when we cut it in LASIK, you're sure to have dry eyes. So these are the things that most people are not aware of. So what I normally do is I give a balanced, all I do is I explain how each procedure is performed, and then you make your decision to which side effects you would rather live with. And undoubtedly, when I explain the both, I would say 100% of patients would pick the implantable contact lens because they know what to expect. It's like your vision when you wear a contact lens. There are no surprises. The vision is better than your contact lenses for the reason that you don't have dry eyes. When you wear contact lenses, you have dry eyes. And the reason is that when you put something on your eye regards the contact lens as being a foreign body. So the quality of tears you produce is not the same as someone who doesn't wear contact lenses. But when a contact lens, the implantable contact lens, is placed within the eye, that's completely different. The eye is actually more forgiving to things being put within it than to things on it. So within it means you don't have to remove it every day, because when you put your contact lens on your eye, you realize that the cornea is not getting any oxygen. It's a bit like a woman who wears thick makeup every day and you're not removing your makeup before you go to bed. So the poor cornea, it can't breathe. And that's why the eye looks red, because it's got all these blood vessels growing to bring oxygen to the eye. Well, when it's within the eye, that's different, because the cornea is breathing. You can swim with it, you dive with it. And the cool other thing that I haven't said is that the implantable contact lens, well, it looks a bit like this, really. If we magnify it, it's tiny to start off with, but if we magnify it, it looks like this. It has UV protection in it. So what that means is that if the times when you need sun protection, which is when you're swimming, when you're diving, these are the times you don't wear your sunglasses, and the times when you actually should be wearing your sunglasses. So this thing has a UV filter within it. And interestingly, we've had patients who've, after I've said that, have done things like, I have had engineers who work in the snow, and oftentimes they've had to lift off their sunglasses in order to do some manual work, and they tell me, "I'm holding you to your word because I'm in the snow and I'm not wearing any sunglasses." And you know that in the snow, the reflection of the snow is absolutely a terrible thing. Yeah. So with LASIK, of course, you don't get this added protection for the reason that we're not adding anything to your eye. So for everyone who needs an implantable contact lens, there is already an increased risk of eye problems because they're short-sighted to start off with. So of course, what I'm trying to say is that the fighter pilot has fewer risks of eye problems of any sort, simply because he's perfect-sighted. But the minute you wear a contact lens, it already means you're at risk of eye problems, simply because it means you're short-sighted, your eyeball is longer than normal. And the sun is actually something that would cause increased problems within your eye. So one of the best things you can do for yourself is to wear sunglasses, yeah, to prevent eye problems. So knowing that the ICL has UV protection, that's a big bonus.